Each year, the United Health Foundation puts out a report about America's health rankings, and we're joined now by Dr. Rhonda Randall. She is EVP and Chief Medical Officer of UnitedHealthcare. How are you?
I'm well, thank you. Happy to be with you.
Happy to have you here. So tell us a little bit more about this report.
This is the America's Health Rankings annual report. It's now in its 32nd edition. It's produced annually by the United Health Foundation. It contains a comprehensive look at our nation's health.
And so when we're looking at our nation, of course, we want to hone in on Maryland. This is Midday Maryland. Tell us what our strengths are here.
Well, like every state, Maryland has its strengths and Maryland has its challenges. Let's start with the good news. Smoking has decreased further in Maryland, down now 14% between 2019 and 2020. It's nice to see that trend continue. However, in all states, we are seeing some alarming increases in the use of e-cigarettes. So that's something that we're going to need to keep an eye on. Air pollution is down in Maryland 19%, so cleaner air. Between the prior measurement period, which started in 2015, and this new measurement period that ended in 2020. We also see that multiple chronic conditions decreased in Maryland. Now, I'm a little worried that that decreased because cancer screenings may have been down, but we saw people who have multiple chronic conditions decreased 17% in the last 2 years, a low prevalence of excessive drinking, a low prevalence of frequent physical distress. That's a self-reported measure that we ask. The CDC asks that question, and a low prevalence of high-risk behaviors for HIV.
All right. Well, that's all positive news. Where are some of the areas that we here in Maryland need to work on?
So in Maryland, we discovered that suicide rates unfortunately increased 19%. That's a lot of lives lost between the year 2015 and 2019.
Is that nationwide or is that specifically for our state as well? I mean, are we seeing that increase across the board?
We are seeing concerning increases in suicide rates. We have been for several years in this report nationally, but Maryland's increase this past period was quite significant. So that increased 19% between the year 2015 and 2019.
That is really, really disturbing. Are there any other areas that we need to improve in, or is that one the one that you really, when you see those numbers, it makes you stop?
That's the most heartbreaking one. A couple others that I'll mention where Maryland can improve. There's a high racial disparity in graduation rate. Maryland ranks 44th in the nation out of 50 states. We're seeing the race that has the highest graduation rate and the race that has the lowest graduation rate. That's a wide gap in the state of Maryland. There's also a high violent crime rate that very much impacts our health. Maryland ranks 40th out of the 50 states in the nation on that measure, and a high incidence of chlamydia, a sexually transmitted infection, 40th in the nation for that measure.
It's important to know the good and the bad, because if you do not have the information, you cannot attack these issues. So reports like this are really, really enlightening. What are some of the key findings that we're finding nationally? Are there any national trends we should be aware of?
So this report is really the first time that we get a look at data from 2020. The report contains some measurement prior to 2020 leading up to the pandemic. We also, the healthcare workforce data actually comes from 2021. So we're seeing some healthcare workforce data, but the majority of the measures come from 2020. And we saw the most alarming finding in the report is devastating, a 17% increase in the mortality rate in the United States between 2019 and 2020.
And were there any other points within this report that you want to share with us that the report uncovered?
Yeah, some things that surprised us. The percentage of adults reporting that their health was very good or excellent increased 13% nationally. I was surprised to see that from 2019 to 2020. So during the pandemic, more adults rated their own health as high. We also saw a 7% decrease in the prevalence of cancer. But like I said earlier, I'm worried that that's not because there's less cancer. I'm worried that's because less people got screened, and now we might find those cancers later. So I'm going to be following that one very closely over the next year. The percentage of adults who engaged in excessive drinking decreased. That surprised me as well, too, because we all saw the reports of high alcohol sales. Now, it looks like we saw a little bit of a shift from binge drinking, so drinking a lot in one sitting, to heavy drinking, so drinking more over the course of a week. So it might be that people, instead of going out, were drinking at home, and that pattern changed.
That's
we also
right. I mean, during the pandemic, you just think like that people were doing a lot more of that. But yeah, it is good to know these findings. If we want to read them ourselves, how can we get a hold of this report?
So it's at americashealthrankings.org. That's our website. And there's a lot of information, 81 measures from 30 different data sources.
Dr. Randall, really, really enlightening. We appreciate you being here, and we'll be right back with more Midday Maryland right after this. Stay tuned.
Thank you. Be well.